Morning, everyone. Welcome to the Wednesday, November 10th COVID-19 response media briefing. I'm Julie Grauert, your facilitator for the event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair Shah, Secretary of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Michele Roberts, Acting Assistant Secretary, and Lacey Farrenbock, Deputy Secretary for the COVID-19 response. To begin today's briefing, we will open with remarks from Dr. Shah. Go ahead.
Great. Thank you, Julie. Thank you for the media team for always helping us through these media briefings. I was not able to be at the last media briefing because I was at our Centennial Accord meeting with our partners, our tribal partners. So I just want to say good morning. It's been a while since I've been on the media briefing, although we did have a media scrum, as you remember, about our great news with pediatric dosing with 5 to 11-year-olds. So it's great to be here this morning. I want to thank our media partners as always. I want to thank our my colleagues, Dr. Lindquist, Michele Roberts, and Lacey Farrenbock for joining this morning. And I want to also thank all of Washington, our Washingtonians who really have been so incredible. We have now, as you all know, we have hit 10 million doses of COVID vaccines that have been given across the state of Washington. And we are so incredibly excited about this. This is such an amazing milestone. And if you don't believe me, I know Michele Roberts is going to remind us what we usually give out when it comes to vaccines in a yearly basis. And so to give 10 million doses of COVID vaccine to more than 5 million people across the state of Washington is just no small feat, but it is an incredibly important milestone. And we just want to thank everybody across Washington who have done the right thing, who have worked to help protect themselves, their families, their coworkers, their neighbors, their neighborhoods, their communities, and ultimately our state. And I also want to just recognize how important it is for us to continue our mission. And our mission is to continue to vaccinate people, whether it's primary vaccinations, whether it's booster vaccines, or whether it's additional folks who become eligible, such as 5 to 11-year-olds this past week. And so it is such an important milestone for all of us, but we also want to recognize that there are still people in our communities who have not gotten vaccinated yet. And we want to do everything that we can to really help people get vaccinated and also recognize the importance of vaccines to protect themselves and their loved ones and those around them. I also want to, I'm going to talk a little bit more about that in just a moment, but I also want to recognize that this is the week of Veterans Day, and we have Veterans Day tomorrow, and I want to join all of our Department of Health and our state in thanking every veteran across the state for their service today, every day, and into the future. Our veterans continue to make sacrifices, and they have made so many sacrifices to serve our nation, and we're so grateful to them for the work that they have done. Yesterday, I had the chance alongside with our team members to, over the last couple of days, we were in Walla Walla. I think many of you may have known that. We were both commemorating the 10 millionth dose, and I'll talk about that in a sec here, but also going to the veterans home in Walla Walla and had the ability to meet with veterans and the opportunity to really be there for our community members who have, again, sacrificed so much for us. And I want to recognize a couple things from our Walla Walla visit. One, I would be remiss if I didn't mention that one of my colleagues, Lacey Farrenbock, was Mrs. Incredible. And so you see her really there with our children. As you can see, we had as young as 5-year-olds, two who turned 5 2 days ago on the day that we were vaccinating. We had 18 children at the Walla Walla Health Department that were able to get vaccinated. And they were so excited. I mean, they were so tremendously excited about getting vaccines. And not only were they excited, but they were also very confident about why they wanted to get vaccinated, and their parents were so excited. And they said, we know that that we may have neighbors or community members who are still thinking about this, but guess what? We want to protect our children, and they were so confident in that. And so here we are that we, as you can see in this image, we had 5-year-olds and up that were getting vaccinated yesterday. And then we also had a gentleman that was in the veterans home who was 96 years of age as well. And so when you think about the stories that we were hearing from 5-year-olds all the way up to seniors and elders in our community about the importance of vaccines, the importance of vaccinations, and the importance of trying to put this pandemic to the end and behind us. It is really so heartwarming that we have so many people across Washington that have done the right thing. So I'm going to just really say thank you to everybody. This is really that moment where we want to express gratitude to Washingtonians for everything they continue to do. But we also recognize that we are still in a very difficult time in our state. Things have gotten a little bit better, and that's great. But when it comes to cases, when it comes particularly to hospitalizations, we are still seeing numbers that are higher than any of us want to see. And it is really important for us to continue to emphasize that vaccines and masking and other kinds of safeguards are really helpful and really key and important for us to be able to fight this pandemic. We're focused on that. We continue to be focused on that with all of our partners on the ground. And I just can't say enough about our healthcare partners and our public health partners who have done so much to help us fight this pandemic. I also want to make mention that as I'll say the personal privilege of being a parent, as a dad, as a physician, as a public health practitioner, as Secretary of Health, it is so important for our parents to really see their kids be eligible for vaccinations all the way down to the age of 5. And we know that over time, it will even be for younger kids that would be eligible. Right now, 5 to 11, 12 to 15, 16, 17-year-olds, 18 and up, we have so many people across the state of Washington who are now eligible for vaccines. But this pediatric vaccines has really been a challenge in our state when it comes to getting appointments. And we want to make sure that the message to our parents is to keep trying, that the vaccine supply, as we have said over the last few weeks, is going to start off slow and low, but it is going to increase. And we know that every parent who wants to have their child vaccinated against this horrific COVID-19 virus will be able to do that in time. So please be patient. And I know Michele is going to be talking more about both vaccine locator, how people can get vaccinated, but also some additional steps that we're taking to be able to help with our vaccine supply. So vaccines are critical. Vaccines are important. Vaccines are key. But we also recognize that we're continue to be in a difficult time in our state, given where we are with our numbers and given where we are with the winter right around the corner, and certainly the start of respiratory disease, including flu season. We want to encourage everybody to get their flu shot as well and do all the things that you can to continue to protect yourselves and those around you. So I'm going to turn it over to Dr. Lindquist, who's going to go through the numbers for cases, hospitalizations, and talk through that. Then Michele is going to talk about vaccines and where we are with specifics related to our vaccine numbers, as well as where we are related to our efforts to continue to vaccinate across Washington. And then Lacy is going to round us out, as always, with additional thoughts and comments about how do we really strategize and what are the pathways that we're looking at as we move forward so that we can continue to be strong and respond to the needs of our communities. And finally, I'll come back with closing with some additional comments. So with that, I'll turn it over to the illustrious Dr. Scott Lindquist.
Wow, illustrious. That's great. Thank you. So here I want to just talk about the cases and where we're at. And if we look at the cases across Washington state, they're very stable right now, but they stabilized out at a very high level. These levels tend to be higher than some of our other waves. But the good news is that there has been some mild decrease, mostly in all ages. And the same goes for hospitalizations. We've seemed to have stabilized out, but we're still having mild decreases. You can see some of this incomplete data still shows some decreasing, but most age groups have started to decrease in their hospitalizations, but our occupancy in the hospitals, which is common at this time of year, still remains incredibly high. And as Dr. Shah said, a lot of this is due to the start of our respiratory virus season. So this year, in addition to COVID, we have to be concerned about things like croup or RSV or some of these other common respiratory viruses. I'm in practice today seeing patient after patient with respiratory virus that is not COVID. So this is really complicating the picture. And as said before, one way to simplify and decrease the burden on the hospitals and the clinics is to make sure you get your flu shot also, so we can take that out of the equation. Now, the big issue on everyone's mind right now is about kids. And our kids are tending to have very high case rates. We've had 7,400 cases in Washington state in kids, and Northeast Washington being the hardest hit in the state. So it's not equal across the state, but the rates in kids are incredibly high. It's like 390 per 100,000. These are rates way higher than we were used to speaking in the general population early in the pandemic. So we're at very high case levels, even though they are showing some decrease. The good news to this is that we are starting to see some increase in our what we call community immunity, or either natural immunity or from vaccination. And clearly the ideal and the best vaccination, plus even if you've had a case, is probably your best chance of being protected. That all affects what we call our R effective. And many are used to talking about this term, but we really look to get our R effective or R not value less than 1. And at this point, it looks like we're reaching that. The concern still being, though, that the major variant we are seeing is Delta. All our variants out of our random sampling right now are Delta variant. And one of the big concerns is, are we seeing an increase in our breakthrough cases? So these are people that have been vaccinated that developed disease or had disease before and developed disease again. And the good news is that percentage is remaining fairly constant. It's around 69,000 cases, which is what is expected for the state of Washington. That is less than one, that's really less than 1.5%. So these are still very small events in the big picture. But it is not just about science or people's opinions or politics here. What we observe is that if you are between 12 and 34, you're 5 times more likely to have COVID if you're unvaccinated, and you're 13 times more likely to be hospitalized. So those trends are pretty constant across the age groups. So that real data that we are experiencing is showing us the protection that the vaccine affords. And so one of the things I want to summarize here is that our community immunity is rising, and this is the perfect time to get vaccinated. Don't get the disease, get vaccinated. And we're right on the cusp of vaccinating a large population of kids. This will definitely help with our community spread of COVID. And at this point, with the R effective being so promising, I think we're really on the cusp of being able to turn this 5th wave down pretty good. Still doesn't negate the need to wear your mask. Really wearing your mask is protection. And then Lacey's going to talk a bit about large gatherings and how to safely navigate this, certainly for the holidays and large gatherings. So all those principles, vaccination, mask, and distancing from others will very much help us get out of this 5th wave. And with that, I turn it back to you, Julie.
Thank you, Dr. Lindquist. We go now to Michele Roberts. Go ahead.
Good morning, everybody. I just got a message saying my internet connection is unstable, so hopefully we'll make it through a few remarks here. So I'm Michele Roberts, and as most of you know, I lead the state's COVID-19 vaccine planning and distribution team. It's been a really incredibly exciting week. Now that kids 5 and older can be vaccinated, we've surpassed a major milestone. And we've given out more than 10 million doses of vaccine. So as Dr. Shah mentioned, an important comparison is our state's universal childhood vaccine program. And through that program, we purchase and distribute all the vaccines for kids from birth to 18. So each year in that program, we give out about 3 million doses of vaccine. And here we are.
Julie, I think we may have.
It looks like Michele may be frozen. Her internet connection, it's holding out on us. Let's go now to Lacy while Michele tries to get her internet back up and running.
Thanks, Julie. Good morning, everyone. I'm Lacey Farrenbock. I'm the Deputy Secretary for COVID-19 response. I want to start by echoing Dr. Shah's gratitude to our veterans for their service to our country. We are extremely grateful for your dedication and sacrifice and that of your families. You have given so much, and we are in debt to you all. Tomorrow, DOH's offices will be closed in recognition of Veterans Day. We will also be closed on November 25th and 26th in recognition of Thanksgiving. And our data dashboards will not be updated on those dates, but they will be updated on the next business day. And as a reminder, you can always check those dashboards for the latest trends and trajectory of disease. The holidays are coming, and we know that many people are really eager to reunite with friends and family after so many months of separation during the pandemic. We do want to give a quick reminder on how to keep those gatherings safer in the winter months. Number one, vaccines are key. Get vaccinated before your gathering. You can still get a J&J vaccine within the next day or so and be fully protected in time for Thanksgiving or Hanukkah. You can also start any vaccine series, J&J, Moderna, or Pfizer, and be fully vaccinated by Christmas, Kwanzaa, or New Year's if you get vaccinated this week. I think you have maybe one extra week for Pfizer, so start that one no later than next week. I am personally very relieved and excited that my family will likely be fully vaccinated by the start of the school winter break. And this means that my 2 children will get to see their cousins, aunts and uncle, their grandfather, and even their great grandmother, who all live out of state for the first time since the pandemic has begun. So number one, get vaccinated. That is the best way to protect yourself, your family, and your community. Number two, take it outside as much as possible. Bundle up yourself, your kiddos, and spend your social time or do activities outdoors to the greatest extent possible. If you are indoors, wear masks and open windows, especially if you have people at your gathering that are not fully vaccinated. And it's always great to have extra masks on hand if you're the host, in case people forget. And really importantly, anyone who is sick or showing any signs of COVID-19 needs to stay home. These prevention measures will help keep you, your friends and family safer, keep our disease rates lower, and collectively, if we work together, we can keep our schools open and safer, our healthcare system protected, and able to serve all of those who need care through these winter months and the respiratory virus season. We also want to recognize that the holidays can bring some unique challenges this year, in addition to those opportunities to reconnect and celebrate. Our relationships with friends and family may have changed over the past many months and throughout the pandemic. And there may be a loss or a sense of loss for many of us around the collective difficulties that the pandemic has brought before us. It's important to honor those losses when we can and how we can, while acknowledging the resilience that has been shown throughout this year by so many people. We are all tired, and this has been a much longer haul than many of us ever thought it would be. If thoughts of this season aren't as uplifting as you would typically expect them to be, know and understand that that's a pretty common experience. We have faced what is known as a secondary disaster cascade with the recent Delta wave, and the impact of that recent surge may leave you feeling like this year was even harder than last year. In many ways, that may be true, but as the calendar turns over to a new year, it may be helpful to recognize the many challenges that we have overcome and celebrate the remarkable efforts made by so many. Our healthcare, public health, and education workers specifically could use some holiday cheer and recognition for all of the work they are doing and have done as we continue to navigate through this pandemic. The holiday season provides us a chance to express gratitude, care, and compassion to ourselves, our family, and to others, to hopefully take a much needed break whenever we can, and to reflect with hope on our collective resilience and all that we are capable of doing together. You can find mental and behavioral health resources and tips, as well as tips for planning safer gatherings at coronavirus.wa.gov. Again, that's coronavirus.wa.gov. I'm going to close out with a quick reminder that next Monday, November 15th, is the start date of the governor's large event vaccine verification requirement. So that proclamation will take effect. And anyone attending a large event who is 12 or older must show proof of full COVID-19 vaccination or a negative COVID-19 test within 72 hours of an event. Large events are any ticketed or pre-registered assembly of 10,000 or more people at an outdoor event or 1,000 or more people at an indoor event. Also, a quick reminder that some local counties or businesses may have vaccine verification requirements for other types of settings and events, and these must also be followed. With that, again, my thanks to our veterans, and I'll turn it back to you, Julie.
Thank you, Lacey. Looks like Michele is back up and running. So Michele, back to you.
Great. Well, hopefully take two will be a success. So again, I don't know where I left off, if I need to cover the 10 million dose milestone again and how incredible that was. Did we get there?
Sure, but it's pretty cool. Let's hit it again. I mean, come on, this is something to celebrate.
It is amazing. So as we know, we've given out more than 10 million doses of vaccine. It's so great seeing the celebration pictures, and really want to note the important comparison is to our state universal childhood vaccine program. And through that program, we purchase and distribute all the vaccines for kids from birth through 18. And each year in that program, we give out about 3 million doses of vaccine, and that's over 12 months. And here we are at over 10 million doses in under 11 months. This is really incredible work of state and local public health, our healthcare providers, so many community partners, and of course, all the Washingtonians who've chosen to get vaccinated to protect themselves and others and help us fight this pandemic. The good news also is that more than 79% of people age 12 and older have received at least one dose of COVID-19 vaccine. And then more than 73% of that group is fully vaccinated. I am proud of how far we've come in less than a year. And as a mother, I know the relief it is to get your child vaccinated. You know you're protecting them from the worst consequences of this disease. Since pediatric vaccine was approved, we know that there's been more than 600 kids across the state who've gotten vaccine and to their state, to the state is receiving their first dose of Pfizer pediatric vaccine. We know the significant data delay here, as providers have up to 3 days to report vaccination into the state's immunization system, and then we take a couple of days to process the data. So we expect that number to rapidly increase over the next week, especially as we continue to get more doses of vaccine into the state. I know pediatric vaccines can be a bit tough to find right now, and I really appreciate people's patience. It's going to take a couple more weeks for the vaccine supply to stabilize. So far, more than 265,000 doses have been delivered into the state, with more arriving each day. Our current allocations show we should receive about 75 additional pediatric doses in our state allocation each week for the next few weeks, but we know there's more demand beyond that. So we have gone ahead and requested additional doses from the federal government. To schedule an appointment to get your child vaccinated, reach out to your pediatrician, your healthcare provider, local pharmacy, or mobile clinic. And to find vaccine locations near you, visit the state's vaccine locator website or vaccines.gov. You can type in your zip code, and at the top of the page, you can filter results to show Pfizer pediatric vaccine locations near you. If there were none available, don't give up. We're adding more data every day. So continue to check back because providers are receiving shipments daily and constantly updating the information we have. If you have questions or need help, you can call the state's COVID-19 hotline at 833-VAX-HELP. Again, that's 833-VAX-HELP. As we head into the holiday season, there couldn't be a better time to make sure you and your family are fully vaccinated. COVID-19 vaccines have undergone the most intensive safety monitoring in US history. Data found the pediatric vaccine to be more than 90% effective in preventing COVID-19 in younger kids. Once everyone in your family is fully vaccinated, you can focus more on spending quality time together and safely gathering for the holidays, and worry much less about getting sick. If you have questions, visit DOH's frequently asked questions page, where we have a new section about vaccinating youth. You can also talk to your trusted healthcare provider. And don't forget, as Dr. Lindquist said, this time of year, COVID-19 is not the only respiratory virus circulating. It's the start of flu season too. You can get the COVID-19 vaccine at the same time as you get other vaccines, like your annual flu shot. We recommend a yearly flu shot for everybody age 6 months and older. Thank you.
Thank you, Michele, and to Michelle's internet that decided to cooperate. We move now.
Before we go to Q&A, I wanted to underscore something really quickly that I think the key message that we're putting out there is that, from 2 weeks ago, we've had still 27,000 new confirmed and probable cases of COVID-19 in our state. We've had close to 1,500 hospitalizations from 2 weeks ago. We've unfortunately added 347 new deaths from 2 weeks ago. So the message is we are not out of this pandemic. We are still having far too many people testing positive, far too many people getting hospitalized, and far too many people losing their lives in our state from this virus that now is largely a preventable disease. And the good news, though, is that we have given almost 500,000 doses of vaccines in the last 2 weeks. So this continues to be a race against a virus. The virus is doing what viruses do. It's taking people on. And if you want to protect yourself, you have to fight back by getting vaccinated, wearing your masks, and doing all the things that we've been talking about, because that's how ultimately we are going to be able to protect Washingtonians, especially as we get into the holiday season. And this holiday season, I think, is an important one because if we did not have vaccines, think about where we would be with the Delta surge. 1 year ago, a lot of us, the only tools we had were masks. The only tools we had were to stay home. Now we have a tool that's in our toolbox that's called vaccines, and we want to continue to encourage people to get vaccinated. Thanks, Julie.
Thank you, Dr. Shah. We now go to our reporter question and answers, beginning with Ariel from the Spokesman Review. Go ahead.
Great, thank you. I have a question or two about boosters. I'm curious how important boosters are for people who are 65 and older, living in long-term care facilities, to keeping our hospitalization rates down this winter, and at what point boosters will be recommended for everyone. Are you concerned about waning immunity in people as they plan to gather for Thanksgiving and Christmas, even if they're fully vaccinated, but just aren't eligible for boosters yet?
Yeah, Ariel, thanks for that question. And, Scott, maybe you can jump in on this one as well. I would say that, boosters are very important, especially for the folks who are in the higher risk, whether it's by age or comorbidities or social conditions. We know absolutely that at some point these vaccines will wane in their protection. Again, it's not an immediate. It is a dial, so it starts to decrease over time, and 6 months appears to be that time frame where we want people to be considering getting booster vaccines. It's absolutely critical for those who are in those higher risk categories, especially those because of occupation or, as Ariel, as you said, because of age. So that is absolutely something that we are recognizing. I know that there are discussions on the federal side about opening up additional categories of people for booster considerations. But again, right now, it continues to be the categories of people that, as I mentioned, are for some reason at a higher risk. And we want to make sure that we encourage those individuals to get their boosters. Scott, did you want to add?
No, I think you covered it very well. I mean, the science is pretty solid behind boosting the antibody response or your ability to withstand reinfection. And, you know, it's just a really exciting time. We've got boosters for high risk groups, which include occupational high risk, like Dr. Shah was saying. So myself, I got my booster dose. No reason to check your antibodies. But along with this, vaccinating this whole group of kids from 5 to 12, it really is very encouraging in the face of very discouraging news of high case rates and hospitalizations.
Thank you.
Yeah,
our next question.
I was just going to add that we know Washingtonians are stepping forward, those who are eligible and getting booster doses. So more than 675,000 people have gotten a booster dose of vaccine in our state so far.
Thank you. Our next question comes from Steve at Como. Go ahead. Steve, can you hear me? You're in here twice, so I'm clicking all the buttons to try to get to you. All right, stand by. Let's move on now to Jessamine from Q13 while Steve and I troubleshoot this. Jessamine, go ahead.
Hi, thank you so much for your time today. Very much appreciate it. Congratulations on the 10 millionth dose. I have a question about boosters as well. As they're being recommended, 6 months where the efficacy starts to wane, at what point does this impact the vaccine mandates that affect employment and verification for entry to certain businesses and venues? Is there a point where people will be required to show their latest vaccination cards? And at what point will the efficacy degradation deem one's original obsolete? Is there a plan for this?
Thanks, Jessamine. Maybe Lacy can jump in on this one. What I would say is that, first of all, we're continuing to follow the guidance and recommendations from a federal standpoint. And right now, there have been some discussion that CDC has put out there related to, again, behind the scenes, what does fully vaccinated mean? How does that change over time when it comes to requirements for boosters or need for boosters? What does that mean for then verifying if somebody, or adding into the mix, verifying that somebody continues to be protected? Because remember, ultimately, when we're talking about requirements, we're talking about verification, we're talking about people going into some sort of business or some activity and showing a vaccine card or having a QR code or whatever that looks like. Ultimately, it's what we're trying to do is to protect people. And I think the key message is not the verification or not the requirement, it's what the end goal is. The end goal is to protect people that are partaking in that activity. And sometimes that's what's forgotten as those requirements get put in place. So right now, we're continuing to follow what that guidance is from a national level, and also the conversations that are happening behind the scenes at the federal level. We are continuing to monitor this as a state. We have not made any decisions at this point about what that could look like or would look like for the future. Right now, we're focused on just getting as many people vaccinated as possible. And right now, our fully vaccinated remains those who have received at least their 2 shots of Moderna or Pfizer, as well as those who have gotten 1 shot of J&J for their primary vaccination series. So, Lacy, I don't know if there's anything you wanted to add on that.
I think you summarized it well, Dr. Shah. You are considered fully vaccinated after that single dose of J&J or 2 doses of the mRNA vaccine. you are still, even with waning immunity, less likely to get COVID-19, and you're certainly far less likely to experience serious disease. But at this time, we're following CDC and using that definition of fully vaccinated for workplace requirements, as well as the large events requirement that takes effect on Monday. We, of course, will continually monitor the science, and certainly, if there is a change that needs to be made, we would be consulting with the governor's office and giving people and businesses plenty of time in that regard.
Great, thank you. Our next question comes from Jake at King 5. Go ahead.
Hi, all. Thanks for the briefing this week. Dr. Lindquist, you mentioned we're on the cusp of turning down this fifth wave, which was obviously very encouraging. What kind of vaccination rate do you need to see from this younger age group, ages 5 to 11, to reach that community immunity that you're talking about? And secondly, the people have spoken. They want to know what happened to your goatee.
Yeah, so let's tackle the most important one first, and that is, I'm not able to predict what percent of this population needs to be vaccinated. There's a lot of mathematical models that look at using R0. In a universal population, it's in excess of 70%. But the point of Washington is we're not universally vaccinated across the state. We've got pockets of like 30%. We have pockets of like 90%. So it's really kind of not my favorite thing to do, to predict an imperfect state like ours where we don't have universal vaccination. And by the way, those models are based on 100% vaccine efficacy. The vaccine's pretty good. I mean, this is one of the best vaccines we've seen in years. But those things in themselves, I'll hold off predicting how much of that pediatric population. My goal would be to say, hey, this is a large segment of the population that is unvaccinated now, so any bit helps. And I would really encourage folks to try and get this vulnerable population vaccinated as much as possible. I do not think a good strategy is to allow people to get disease, to have what we call some sort of natural immunity. The recommendation still remains, if you become infected with COVID, that you actually get the vaccine series. That is your best chance of protecting yourself. And the goatee was just a whim. Just one day looked in the mirror and said, time to go.
That said, Jake, I'm glad that Scott was very clear that the most important question he was going to answer first. But we do appreciate you asking Jake that question. So you gave us a smile, so we really appreciate that. I did want to just underscore one additional thing that Dr. Lindquist mentioned, which is really this is why we continue to be so focused throughout the state of Washington. Even in communities that have high vaccination rates, there are pockets in those communities, those counties, and even in other parts of the state where you don't have this uniform 70, 80%, we really want to do everything we can to encourage people to get vaccinated. Our Power Provider Initiative has been going well. Our Caravan Initiative has been going well, but we need to continue to focus on really working with our partners. Again, the Walla Walla Health Department partners this past week, we just have continued to do just an incredible job of really just doing everything they can to help vaccinate people. And we want to do that all the way across the state of Washington.
Great. Our last question comes from Joey with the Puget Sound Business Journal. Go ahead.
Hi, thanks. Do you have any update on the QR tool for vaccine verification? And then is there anything that the state's doing in anticipation of that workplace vaccine mandate that the governor might take even a step further on ways to simplify the process for employers, and then gearing up to that number 15 rule, ways to make it easier on staff at these venues?
Lacy, why don't you take that? And I think Jake is still off mute. Jake, great question earlier, but we got to get you back on mute somehow.
Oh, sorry, that's not me.
No worries, thanks.
All right, so we are working on a QR code solution. I expect we'll have some bigger news to share on that within a week or so. And that could be used by employers, it could be used by businesses, it could be used by large events. We just, we are standing this up pretty quickly, like many things in the pandemic, and we want it to be a good experience for the users, users being, you know, the people of Washington trying to get verified and those businesses and events that are verifying. As a reminder, there are many ways to verify vaccination. My apologies. Those include your CDC card or a photo of the card, a vaccine certificate from MyIR, mobile.com. You can have a copy of your electronic health record or other documentation from your healthcare provider. So any of those ways to verify are acceptable. And in terms of the federal Osha rule, the Department of Labor and Industries, Governor's Office, and DOH are looking at that rule, and which is, I think, on hold based on a court hearing in, I believe, Louisiana. But we are looking at that rule and what it means for our state. And I think, you know, probably would defer to the governor's office on more to share in the coming days or weeks. But we understand that it would impact a large number of businesses, and we want to support them in implementation of that law as it applies to them and any business or entity that wants to verify vaccination. And again, a reminder that there are local counties that have requirements beyond those of the state. And there are just private businesses that are choosing to do this to protect their own employees and customers. And we want to help those businesses as well.
Thanks, Lacey. I'm just going to close this out and then turn it over to Julie and just say thank you again to my fellow panelists, Scott, Lacey, and Michele, for joining this morning and providing this very helpful information to our communities. You know, going to Southeast Washington and seeing 5-year-olds get vaccinated, and then visiting veterans and seeing, you know, the protection that 90-plus-year-olds have also received because of vaccines. It reminds all of us of how incredibly important vaccines are to preventing further disease and also protecting ourselves and ultimately ending this pandemic. We want to continue to build on the success of 10 million doses administered across the state of Washington and over 5 million of our community members who have already been vaccinated. And what we want to remind everybody is that if you have not gotten vaccinated yet, please do so now. The holidays are right around the corner, Thanksgiving and getting together and, you know, everybody getting that ability to be together safely. And we want to encourage everybody, this is the time, you still have time to please get your primary vaccine series, please get a booster shot if you're eligible. And certainly we want to encourage our kiddos to get vaccinated. And that is really critical for all of us to end this pandemic. I do want to underscore the last point here, which is really about the mental health and emotional concerns that we have, again, entering year 2 of this holiday season. And we want to make sure that people are really availing themselves of all resources out there. Department of Health is committed to protecting Washingtonians along with our state agencies. We want to thank all of our state agencies that will continue to work with us. And we will say we will do everything we can to continue to protect our community members. And certainly that means that we are going to also work with all of our partners on the ground, including those in Walla Walla. And I just want to thank them again for hosting us this past couple of days. And with that, Julie, I want to turn it back to you and just say thank you again to all of Washington for 10 million doses administered.
Yes, congratulations to all for the 10 million doses. Thank you to everyone for attending today. We will continue to do these briefings throughout the holiday season. Our next one is scheduled for next Wednesday, November 17th at 10 a.m. We will continue to send you those briefing update bulletins and look forward to talking to you again then. Have a great day.